Sure, my name's Dennis Phelps. I live in Colorado Springs, Colorado, and my occupation is a registered nurse. I am a registered nurse at Memorial Hospital in Colorado Springs. I work in the radiology department. My main job is sedation, recovery of patients in CAT scans, MRIs, as well as when they have interventional radiology procedures done, meaning dialysis grafts, shunts, drains, ablations, a lot of things.
Can you describe a typical day? What kind of activities do you do?
You come in, everybody staggers in because we have a pretty long shift.
Mm-hmm.
So people come in every hour or so. We usually take practically between 3 to 7 patients in a 9-hour shift. And then it depends if you're in CAT scan doing drains or if you're in MRI sedating patients who can't go into a scanner. Or if it's an interventional radiology where you'll be doing dialysis, grafts, shunts, anything like that.
How long have you been at your current job, and what kind of other jobs have you had in the past?
My current occupation at the hospital has been over 22 years. I've worked in the ER. I was a trauma nurse for approximately about 8 years. I was a PACU OR recovery nurse for about 8 years. I've been in radiology as it stands for probably about 6 years or so.
Who are your coworkers, and what kind of activities do they do?
Activities, they do what I do. Everybody has to go everywhere.
Mm-hmm.
We're not limited. And my coworkers are mostly females. We do have a few men, but majority of them are females.
Can you tell me about a time you have ever been treated differently because of your gender, or has it affected the work that you do?
Doesn't affect. The only thing it does for a male is during certain procedures that females only could be in.
What is it like going from a male-dominated job as a firefighter to a female-dominated job as a nurse? What kind of differences did you see?
I wouldn't say the male and female between firefighters and nursing, but you're living and sleeping and being very close quarters with your firefighters,
yep.
And you rely on them. Nurses, you do the same thing. There's a lot of things I have to rely on with a nurse.
Mm-hmm.
In the ER, it was probably just like being in the firefighting business. So, but nothing different.
Has there been any issues with your gender because of patients? Not because of like their specific condition, but because of their bias?
I think it comes to, yes, there is. With the influx of people from the Middle East, we do have occasionally that a female has to be with a female patient.
Mm-hmm.
There are some cases where some religion that a rabbi has to be with a patient. I think those are two situations. And yes, there has been occasions that people make the assumption that all male nurses are gay.
Mm-hmm.
Not right.
Yeah.
And I have been requested when I was charge nurses to have nurses switch because of patients' feelings about a nurse.
Has anyone ever mistaken you for a doctor rather than a nurse?
All the time. It's very typical. Very much typical.
Do you work with any female doctors?
I do. I've worked with a lot of female doctors. And now we have a new radiology physician who just got out of residency. Very young, very eager. She just sometimes has a hard time understanding us men. But I think it's just the way we work at the hospital.